The periodontal exam. The perio exam is very important because it's something we refer to quite often to determine what type of treatment we need to come up with for the patient and what's going to be best for them based on what we're seeing. So it can be done in conjunction with the new patient exam, where we're already going to be documenting what's existing, what treatment needs to be done. We're looking at pocket depths to determine what type of cleaning the patient is going to have to be scheduled for, or it can be done on its own, either with the dentist or the dental hygienist. Your role as a dental assistant is going to be equally as important because you're the one that's going to be in charge of making sure all of this information gets recorded and documented appropriately. So it's going to begin with, again, you taking vitals, you're updating the patient's medical history, you're identifying any changes, if any, to the medications, and you're documenting all of this. That's something that's done every time you see a patient. It's then going to consist of the dentist or hygienist looking at the mobility of the teeth. So between two instruments, they're going to check to see the movement of teeth, if any. What you need to know is that our teeth have a slight movement to them naturally. If you remember, what surrounds the root of the tooth is the periodontal ligament, which acts as a cushion or a shock absorber when it comes to our chewing forces. So our teeth are going to move slightly because of that periodontal ligament. So what you're going to be recording are the different levels of mobility. 0 is going to be considered normal. 1 is going to be considered slight mobility. 2 is going to be considered moderate mobility. And 3 is going to be considered severe or extreme mobility. And as I mentioned, here, this happens to be EagleSoft here. So for those of you who have already taken prevention and nutrition, this should look very familiar to you. For those of you who have not, then this is a preview of what to expect. And if you talk to your fellow students about especially perio charting, they may tell you that it's difficult. It's just because the hygienist and the dentist, as they're calling out various numbers, you have to keep track of where you are constantly, and it can be a little tricky sometimes. But as you get used to it and you do it more and more, it does get a little bit easier. So here on the left-hand side is your legend, and on this legend you have different abbreviations. So mobility is actually going to be right here at the top, and it's going to be again tracked with the levels. So you can see that on tooth number 4 and 5, it has mobility of 3. On tooth number 12, it has a mobility of 3. On tooth number 13, it has a mobility of 2. It is going to be up to the clinician to determine if they're going to want to document 0s and 1s. 0s and 1s aren't too bad. What we really want to make sure that we're keeping track of is those 2s and 3s for sure, to make sure that those don't get any worse. The next thing that they're going to look at aside from mobility is the oral tissue. So if we go back to this picture here, they're going to be doing a visual exam of the tissue to make sure that it looks pink, it doesn't look irritated, swollen, red, anything like that. And we're going to indicate that and document that. They're going to be looking at the pocket depth using a special instrument that is going to be going into that gingival sulcus along that free or marginal gingival area, and determining what those numbers are, how much bone loss, if any, there is. A 1 to a 3 is considered to be normal. Anything over a 3 is considered to be bone loss. And the higher the number, that's obviously going to indicate that there's more bone loss. So we can see here, it's indicated as PD. And like I said, all of these numbers are going to be called out. You get 3 readings for both buccal and lingual on both the maxillary teeth and the mandibular teeth. So you're going to be going all the way around the mouth and then beginning and coming all the way around again on the lower. So as the dentist or hygienist is calling out these various numbers, you're just recording them as you're going along. So you can see this patient has some 2s, has some 1s, has some 3s, 4 here. This tooth right here, number 12, that had a mobility of 3, you can see that there is some bone loss going on, some of it pretty severe because we have pockets of 4 on either side and a pocket of 5 in the middle of the tooth. And coming back on the lingual, we have some 5s, 6s, and 4s. So we can see definitely why this tooth would have a mobility of 3 because those pocket depths are pretty deep. Very good indication of some severe bone loss going on in that area. You notice that the 3s, 4s, 5s, 6s are all highlighted in red, and that's to indicate that those are areas that we need to make sure that we're focusing a little bit more on. Even though 3s are considered normal, it's indicating red because it's at the very highest level of what would be considered normal. So we want to make sure that we are addressing this issue right away and making sure that the patient's oral hygiene is up to where it needs to be so that these don't get any worse. So you're going to be, like I mentioned, recording all of this information when it comes to pocket depth. They're then going to be looking at the bleeding index and determining if there's bleeding upon probing. And you're going to indicate that here. You can see it's the little circles that are red. All of these areas here is indication that there was bleeding upon probing. And again, this whole thing lets us, it acts as a visual for our patients. We can actually show this to them and let them know that on this tooth, there was a lot of bleeding pretty much all the way around this tooth and why we need to maybe focus a little bit more on that area. We're going to be identifying suppuration, and suppuration is another word for exudate or pus, and we can see that in the middle of tooth number 12 on the buccal. It had a perio reading, a pocket depth of 5, mobility of 3, and there was some pus that was coming out of that area as well. So along with the bleeding, it also had some pus, so we can determine that there is possibly a little bit of infection going on along that tooth. What's also nice is that we can do a comparison for our patients, so we could either do it in list form like this, or we can do it as a graph form. But this is a tool that we can use to show our patients their progress. And we can see, and tell them that, hey, Mr. Abbott, on this day, your pocket depths, your readings, you had some 4s, but overall looked decent. However, back when we saw you in 08, some of those greatly improved, but there were some areas that the pocket depth actually got a little bit worse. And it's an area that you can say, we need to maybe have you do a little bit more flossing and making sure you're angling your toothbrush a little bit more along that area. So this allows us to use this as a tool to help educate our patients on how they're doing at home and why it's important. So when they tell us that they are brushing and flossing every single day, this can certainly show us that they truly are not. And it gives us an opportunity to maybe readdress the oral hygiene instructions with our patients, going over toothbrushing and flossing and making sure that they have a very good understanding of that. Also going to be looking at the occlusal. So as the patient is biting together, what does that look like? Because if they're biting a little bit higher on a certain tooth or a certain area, that could possibly, lead to some problems down the road because they're constantly banging on that area there. So very important to make sure you're recording the information accurately. X-rays is going to be another tool that we're going to be using. X-rays allows us to determine what's going on underneath the gum tissue. Helps us to identify any issues and any pathologies going on. And the traditional or more common way to take, especially for hygiene appointments, is going to be your horizontal bite wings. That's going to be how you're going to take all of your x-rays when it comes to recall appointments or hygiene appointments, is horizontal bite wings. And here we can see we're able to determine bone level right here, which in this patient, it doesn't look too bad. However, if we're dealing with a perio patient, this is where we're going to want to switch to using vertical bite wings, because it's going to allow us to see a little bit more than we can with our horizontal. You can see that even though with the horizontal bite wing, we're able to see a little bit of the roots, we are not able to see like we are in the vertical bite wing pretty much to the apices on all of these teeth. So we're able to determine, especially if the bone loss is a little bit more severe, because had we just taken on this patient a horizontal bite wing, all we would have been able to see on this patient is what would be in between this area here. We would be able to determine that this patient has bone loss. We just wouldn't be able to see the severity of the bone loss because all we're seeing is just in here. We're not seeing anything out here. So when we're dealing with perio patients, our x-ray of choice is going to be vertical bite wings. Let me take that off. And that way we're able to, again, determine where the bone level is on this patient. We can clearly see that along this canine here, it's, there's some bone loss. There's definitely some bone loss going on. Bone level should typically be roughly about right here. And for upper, should be roughly about right there. And so you can see that there is significant bone loss, especially more so in some areas than others. So that's why vertical bite wings in this case is going to be important. We can see, like I mentioned, along the canine, it's pretty steady across. Once we start getting into the second premolar here, the bone level starts to drop and recede a little bit more as we get along to our molar area. Another part of the exam is looking at the furcation, this area right here. And if you remember, furcation is only going to be on multi-rooted teeth. We know that our mandibular molars have 2 roots. Our maxillary molars have 3 roots. So we're going to be identifying this furcation and trying to determine how much of a furcation is going to be involved with a tooth. So that is going to be another part of the exam that we're going to be looking at. Aside from mobility, bleeding, pocket depth is also furcation level. So we can see on this patient that there is a lot of bone loss here. There's not much holding this in. So you can probably determine just by looking at this x-ray that this probably has a mobility of about a 2 or a 3. More than likely, this tooth cannot be salvageable. It's really gonna depend on a lot of different things. As we come up to the maxillary teeth are a lot worse than mandibular teeth. We can clearly see bone level here on this canine. Not much holding this first premolar in, not much holding this second premolar in, and it's a little hard to determine what's going on here without having a molar vertical bite wing. So this and this tooth more than likely have mobilities of 3, probably 7, 8 pocket depth, depending on where we're probing. And more than likely these teeth, possibly this tooth, and maybe this tooth are going to have to be extracted. So that is why it's important for us to make sure that we are taking x-rays, we're doing our exam, we're recording the information appropriately so that we can hopefully maintain our patients where they are so they don't get any worse. Or we might have to maybe come up with an alternative method for them because we may have to be taking out teeth where they're looking a little bit like this person here, where they are have had to lose some teeth, possibly as a result of either decay or severe bone and tissue recession.